Hello everyone. Today's video is a video about a recent case that I've been working with, a patient dealing with Parkinson's disease, and we've been having some really good results, and I just wanted to share some of the things that we've been working with because quite frankly, I know from experience, having worked with quite a few patients with Parkinson's over the years, that it's a disease, it's a diagnosis that has a lot of, comes with a lot of gravity. It's a condition, of course, that in conventional medicine, the options are really, go on medication. That's hopefully going to work, quite well for a while, gradually work less well. There might be some more invasive or intense treatments that might be available when medication isn't working as well. And then after that, there really aren't a whole lot of other options. So it's not to say that it's a rapid deterioration, although it can be in some cases, but it doesn't have the best long-term prognosis. So I wanted to share this video just to give folks out there some hope and hearing about some other options that maybe have not been discussed with healthcare providers they've worked with up to this point. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the patient I'm referring to, a lovely gentleman in his 50s, and had a Parkinson's diagnosis about 5 years ago, working with medication, classic case that I just kind of alluded to there, where medication was working, helping to keep symptoms under pretty decent control, but then just gradually needing to increase the medication over time, not working quite as well. So he came to see me. So he came to see me maybe 6 months ago, 8 months ago or so, and I recommended that he start working with some glutathione. Some very interesting research evidence out there about glutathione and Parkinson's, but then also quite a lot more clinical experience out there with glutathione and Parkinson's, where in some cases it can be very, very helpful with mitigating symptoms or reducing symptoms to some extent, sometimes to a great extent. Sometimes intravenous glutathione is used, sometimes oral liposomal glutathione. In his case, we were doing oral liposomal glutathione. So started him on a pretty robust dose of that, started him on some comprehensive mitochondrial support. I've posted about comprehensive mitochondrial support a number of times in the past, so please cross-reference those videos. Easiest way to do that is on my YouTube channel if you're not already watching this on YouTube. But in a nutshell, has high doses of the vast majority of the B vitamins, certain antioxidants, amino acids, minerals and trace minerals. So we're working with that. Also working with a product called BodyBio PC. BodyBio PC is made by a company called BodyBio. It's a phospholipid complex, and phospholipids are very, very important for all of our cell membranes and every cell of the body, but very, very particularly important in the brain. So we're working with that as well. And then we're also working with a multi-nutrient with methylated B vitamins. And as I've described in other videos before, the multi-nutrient complements the mitochondrial support formula with some of the kind of lower dose fine tunings that we need to make sure that the mitochondria are being as supported as well as possible. So the mitochondrial support formula is kind of the big workhorse with the high doses of things, but then the multi is a complement to that. So we're working with that. In a perfect world or ideal scenario, that patient would have been coming in for, say, some intravenous ozone therapy, maybe some methylene blue, that type of thing. But distance and finances and whatnot were a factor, so we're working with the supplements. That was all well and good. And so the patient also agreed to let us do a brain map on him, a QEEG brain map, and to take a look and see how things were looking. So if there's interest in this video, I may post a follow-up one actually going through that brain map, kind of, because we've done two to date, which I'll talk about in just a second, but actually showing those images. If anyone's interested, I'm happy to do a follow-up video on that. Anyways, long and short of it, did a brain map, and we saw that there were some significant dysfunctions with, or significant imbalances, I should say, in terms of the brain waves. So we saw, if memory serves, some elevation in delta brain waves, some notable elevations in alpha brain waves, beta brain waves, and so we started, the patient decided to start doing some neurofeedback treatment. So came in for those treatments. We did a series of 8 or 9 treatments, did a follow-up brain map, and had a follow-up to see, how are you doing? And lo and behold, doing so much better. Significant reduction in tremors, significant improvement in ambulation ability, improvement in balance, improvement in sleep, improvement in overall mental health, and overall the brain map looked markedly better. So we saw a significant reduction in the delta brain waves, improvement with the alpha and the beta brain waves. Brain map still didn't look perfect, but we saw some really nice movement in the right direction, and quite frankly, much faster improvement in the brainwave patterns than I would normally have expected in such a case, because symptoms were not like super severe, thankfully. Things hadn't progressed to that point. The medication was still helping, but was really happy to see such positive change after that number of treatments. I dare to say that some of the supplements are probably helping with that, and fellow was eating a healthy diet as well, which is helpful. But long and short of it, we did the follow-up brain map, looked quite a bit better, feeling quite a bit better. So we're continuing with the same supplement regimen. He's going to do some additional neurofeedback. We're switching up the protocol just to fine-tune the areas that are still not looking 100% on the brain map, and we're going to keep on plugging away. For those of you listening who maybe aren't familiar with neurofeedback, so with neurofeedback, we're using this as a non-invasive method to help regulate the brain waves in the direction that we want them to be regulated in. So where delta was too high, we set the programming to lower the delta. Where beta was too high, we set the programming to lower the beta. So we're basically using the neurofeedback to help regulate those brain waves. And so what's very, I think, interesting and relevant with a case like this is that we know from the research literature that neurofeedback has been shown to help improve blood flow to the brain, and it also is something that helps to improve neuroplasticity in the brain, and it also helps to improve growth factor delivery to the brain, including brain-derived neurotrophic factor, or BDNF for short. So for patients like this, where obviously with a neurodegenerative condition, we want to try to optimize brain function as much as possible, get as many nutrients and growth factors to the brain as possible. Neurofeedback is, in my opinion, a great adjunct just on a physical level to help get more of that blood flow, get more of those growth factors getting to the brain, over and above the brainwave balancing effects that are of benefit too. So there's kind of a bit of a 2-for-1 component there. They're not mutually exclusive things that are happening, but again, when we're thinking about, okay, bird's eye view, what are we doing with this protocol? Well, we want to support brain cell bioenergetics. So that's your mitochondrial support. That's the complementary multi-nutrient. That's the phospholipids, because phospholipids are important for mitochondrial function as well. We want to support overall cellular health and integrity. So that's tied in with all the mitochondrial supports, but then also the phospholipids for the cell membrane integrity. We want to try to optimize antioxidant levels as best we can, which would be the separate glutathione plus all the antioxidants that are in the mitochondrial support formula, namely vitamin C, vitamin E, resveratrol in there, CoQ10 in there as well. And then we also want to try to stimulate brain healing as much as possible through growth factors. So that's the increased blood flow and the BDNF from the neurofeedback. There are other tools that could be brought into the mix as well, things like methylene blue, things like PEMF therapy, transcranial laser therapy, or photobiomodulation. There's definitely other tools that could be used. Chelation therapy could be helpful potentially. Different intravenous ozone could be helpful. So there's lots of different tools that could be useful, but this was the protocol that we decided to work with this individual, and thankfully seeing some really favorable results. So I hope this was of interest for those of you out there who are dealing with Parkinson's or have loved ones who are dealing with Parkinson's. My heart goes out to you. I know that it's a very challenging condition to manage, but hopefully there's some inspiration that comes from listening to this video or watching this video. And any questions or comments on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.